Good afternoon. I would like to thank each and every one of you for being here with us at this live session from MAHSA University, Sarjana Putra campus. I am Nur Farina, lecturer from Faculty of Health Sciences, Nursing and Education, MAHSA University, and I will be moderating today's session. Today's webinar, Fostering a Safety Culture in the Workplace, is proudly organized by the Faculty of Health Sciences, Nursing and Education, MAHSA University. Dear viewers, before we proceed further, I would like to give you a brief overview of the programs offered by the Faculty of Health Sciences, Nursing and Education at MAHSA University. Faculty of Health Sciences, Nursing and Education comprise of physiotherapy, medical imaging, environmental health, occupational safety and health, School of Nursing, and School of Education. There are 3 departments and schools under Faculty of Health Sciences: School of Physiotherapy, Department of Environmental Health, and Department of Medical Imaging. We offered program from diploma until master level. Why join health sciences? There are high job demands for this program after the graduations, as we are considered under essential services. There are no boring work routines and lucrative remuneration for the graduates. There is also low risk of job redundancy, as the job cannot be automated. There are also opportunities to work in variety of settings, such as hospitals and healthcare facilities. It is also a career that you can feel good about, as we are concerned with the well-being and health of the public. Our program, Master of Physiotherapy, is a 1-year full-time program or a 2-year part-time program. These are the entry requirements for the Master of Physiotherapy. Bachelor's degree in related field with minimum CGPA of 2.5 or less than 2.5 with minimum of 5 years of working experience in related field. Bachelor of Physiotherapy, Bachelor of Physiotherapy Open and Distance Learning, Bachelor of Environmental Health and Safety, Bachelor of Environmental Health and Safety Open and Distance Learning, Bachelor of Medical Imaging, and Bachelor of Medical Imaging Open and Distance Learning. These are the entry requirements for the bachelor's program. Matriculation, pre-university or STPM, with minimum of GPA 2.33 in 2 of the following subjects: biology, physics or mathematics, and chemistry, or A-level, minimum grade B in 2 of the following subjects: biology, physics or mathematics, and chemistry, or diploma in related field with minimum CGPA of 2.75 or less than 2.75 with minimum 3 years of working experience in related fields. Diploma in Physiotherapy, Diploma in Environmental Health, and Diploma in Medical Imaging. These are the entry requirements for our diploma program. SPM, pass in Bahasa Melayu and English, and 5 credits in the following subjects: mathematics, 1 science subject, and any other 3 subjects, or GCE O-level with pass in Bahasa Melayu or English and 5 grade C in the following subjects: mathematics, 1 science subject, and any other 3 subjects, or certificate in the field of health sciences with minimum CGPA of 2.75. Lastly, our diploma in Occupational Safety and Health is also a 3-year program with entry requirement SPM, pass in Bahasa Malaysia and English, and 3 credits in the following subjects: mathematics or 1 science subject, any other 2 subjects, or O-level, pass in Bahasa Malaysia and English, and 3 credits in the following subjects: mathematics or 1 science subject, any other 2 subjects, or certificate related to health science with minimum CGPA of 2.5. So why choose Faculty of Health Sciences, MAHSA University. We have experienced and dedicated international pool of academic staff. We also have cross-teaching by experts in whole MAHSA. MAHSA has the most number of health disciplines in a single institution among the IPPS. We also emphasize on hands-on clinical skills, be it face-to-face or online platform learning management system (LMS). We also have wide list of hospitals and institutions for clinical and industrial placement. Most importantly, we are accredited by NQA and JPA with international recognitions. We have programs with dual awards with Anglia Ruskin University, United Kingdom. These are among the scholarships MAHSA offered for the eligible students: Haji Abdullah Academic Excellence Scholarship, Foundation Scholarship, Durable Scholarship, School Teacher Scholarship, Family Scholarship, and the Single Parent Scholarship. These are among the collaborations and affiliations. In MAHSA University, we are not just emphasized on academic achievement. We also encourage students to participate more in the curricular activities and also to build a social networking. As such, we also have mobility program. Previously, we have students sent to universities such as Iryosose University in Japan, Lovely Professional University in India, and also Universitas Sriwijaya in Indonesia. Thank you. Please contact us through MAHSA website or through our faculty Facebook page to know more about our programs, or simply leave a comment. We will give feedback to you. Your questions concerning with this webinar session can be listed in the chat box. On to our main session for today. Occupational Safety and Health, OSH, in the workplace requires more attention due to the increased importance placed on this by regulators, clients, and workers themselves. Incidents and accidents in the workplace negatively impact the establishment and its workers due to the increased staff turnover, reduced productivity, increased compensation, rectification cost, and negative emotions. Therefore, it is imperative to enhance safety practices and foster a safety culture in the workplace. Both employers and workers need to understand their responsibilities regarding this issue. Now, let me introduce speakers for today's webinar, Dr. Nofadila. Dr. Nofadila holds a PhD in Environmental Management majoring in Occupational Safety and Health, a Master of Science in Environmental Development and Sustainability, and a Bachelor in Environmental Technology. Before joining MAHSA, she worked as a research assistant for 11 years, where she was involved in several key research projects. During this time, she honed her skills in data collections, analysis, and reporting, contributing to numerous studies that have advanced the field of occupational safety and health and environmental management. Dr. Nofadila, the screen is all yours.
Thank you, Ms. Safarina. Before that, I would like to extend my gratitude to the audience for joining us today. A special thank you to MAHSA University and my Dean, Prof. Veronica, for this opportunity to share my knowledge and research finding in the field of workplace safety culture. Okay, As for introduction, I will introduce to you the occupational safety and health definition. So safety is the state or condition of being free or protected from injury and damage. Okay, we can declare our place is safe when we are assured that there is less possibility of being injured and harmed. Health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So, occupational safety and health is the sign of the anticipation from the workplace that could impair the health and well-being of workers, taking into account the possibility impact on the surrounding communities and the general environment. So why the occupational safety and health is important in a workplace? Number one is for legal requirement. According to International Labour Organization (ILO), all countries, especially UN members, shall establish and implement a national policy on OSH. Okay, number two is economic reason. OSH is important for a company to prevent loss and to increase their business sustainability, which can increase their corporate image. Okay, number three is humanitarian reason. Okay, according to ILO statistic, 102,000 million occupational accidents occur annually at workplace worldwide. So safety and health working condition is a fundamental human right. Apart from the factory workplace, working in the office is also exposed to a large number of risks. As you can see here is number 11. Boards are blocking the fire exit, which all fire escape routes must offer free, unobstructed evacuation from the premise. Okay, another example is overloading a trolley to move files, which is number 5. This situation can cause an impaired control and can cause tipping over. Based on this office situation and various of hazard that we can find, we need some effort to nurture a workplace safety culture. So what is a safety culture is all about? A safety culture is the collection of the belief, perception and values that workers share in relation to risk within an organization, such as a workplace or community. So a safety culture is the result of combined individual and group effort towards values, attitude, goals and organization health and safety program towards organization health and safety program. Okay, safety culture is commonly viewed as an enduring characteristic of an organization that reflected in its consistent way of dealing with critical safety issues. So safety culture is one of the approach for preventing workplace accident. So why is safety culture is important? A strong safety culture ensures that a high level of standard is set for all safety process. In addition, implementing a positive safety culture can promote a sense of commitment to safety and helps encourage worker participation and accountability in workplace safety. A safety culture is also improve safety performance, which ultimately result in fewer incidents. So how to assess your safety culture? Okay, step one is to review documentation, program and policy. Okay, maybe you can begin by familiarizing yourself with the documentation on current and past program, especially for the safety program. Second step is communicate prior to worker interaction. Okay, you can inform all within the organization of the activities of the assessment. Okay, and then third step is conduct a location walk. As early as possible in the visit, a site tour should be arranged. The tour should include the major area of the site where work is in progress. Okay. Step 4 is leadership discussion. Maybe you can give a half-hour briefing, okay, to the key personnel in leadership especially for top management, okay, to build awareness among them. Step 5 is provide a report focusing on internally actionable item. Okay, number 6 is implement a safety perception survey. The previous research is often called this safety perception survey as a safety climate survey. Okay, so in this sharing session, I will be focusing on my research on safety climate to assess the safety culture. And then I will recommend a solution to foster a workplace safety culture through my research finding. Okay, so as I said, that I will focusing on safety climate. So the diagram is to illustrate how the safety climate concept serve as a mean to assess and enhance safety culture within an organization. Okay, by understanding and improving the shared and individual perception of safety, organization can achieve key objectives such as predicting incident, facilitating decision making, and ultimately increasing the safety culture. Okay. So based on safety climate, previous research, there are various elements to assess the worker safety perception or on safety culture. Okay, the elements are inconsistent and often depend on the importance of a study. One of the element is management commitment. Okay, management commitment is the highest element that has been addressed in safety climate research. Okay, through the table, the communication dimension is also prioritized. Effective communication is a priority for an organization so that workers are clear with safety demands in the workplace and strive to engage in any safety program. Okay, according to safety climate theory by Zoha 2003, a safety climate needs to be measured from various levels of the organization. This theory explains that workers' safety climate perception directly impact the level of knowledge, motivation, and outcome expectation. The theory by Griffin and Neil 2000 also explain the relationship between safety climate and worker safety performance. Dimension of knowledge, skill, and motivation mediate between the safety climate and worker safety performance. Meanwhile, in the safety climate theory by Jiang 2010, proved that the level of knowledge and attitude of colleague or co-worker also influence the worker's safety behavior and safety outcome. Brondino 2012 construct a safety climate theory that explains the relationship between the safety climate of top management, supervisor, and co-worker with employee safety performance. In this theory, supervisor and co-workers mediators for organization and employee safety behavior. Based on the previous research and safety climate theory that has been explained to you, I have developed this research framework. My study argued that the relationship between the three constructs of safety climate, namely top management, supervisor, and co-workers, each has its own influential relationship. Therefore, my research models these figures, which is top management, supervisor, and co-workers, as shown, and each is directly linked to the construct of employee safety performance. To validate this framework, questionnaire was distributed to several companies in Malaysia. The collected data was then analyzed using SPSS and the structural equation model by Amos. Okay. So based on EFA and CFA testing through Sam Amos application, this is the finding of my research. As you can see here, the three constructs of employee safety climate, which are organization, supervisor, and co-workers, are proven to provide a positive effect on employee safety performance. The model also proved that the 11 dimension positively support each figure. Okay, so all of them are proven to provide a positive effect on safety performance. Through this research, these are some findings to foster a workplace safety culture. If you are an employer or top management, you should improve the safety communication quality between you and your employee. Okay, and then you have to provide worker with adequate safety training for your organization, and then develop a proper occupational safety and health system management. Okay, as maintaining safe work facility, machinery or equipment. And fourth is improve the leadership style. Okay, you need to focus on safety issue. If you are a supervisor, he has in-depth knowledge of a safety issue in order to translate the instruction of top management to subordinate employee, and then has a good leadership skill, and then improve workers' compliance with adequate safety procedure and safety information. Lastly, be smart in giving advice and explanation, as well as smart in resolving every problem that arises among workers. So lastly, if you're a co-worker or as a worker, you need to have a high level of competency, especially for safety knowledge, skill, and motivation. And second is you need to give information, support, guidance, praise, emotion, and a caring attitude towards others. Okay, the last one is comply and participate in all safety program organized in your workplace. So in conclusion, everybody has to play their own role to nurture or to foster the safety culture in the workplace. Because implementing a strong, positive safety culture required commitment and hard work from all parties involved. In short, creating a strong safety culture doesn't just make your organization a safer place to be, it lays the foundation for building a better business for the future. All right, Ms. Safarina, that's all. Thank you. Back to you.
Thank you very much, Dr. Nofadila, for the such insightful presentation. Dear viewers, if you have any questions for Dr. Nofadila, please leave a comment. Please fill in the survey form, which can be found at the comment section. By the end of this webinar, ECert will be awarded. Okay, let's see. Okay, there's one question from Shamita Sharmi. Yeah? How can we leverage technology to enhance our safety culture? Okay, Dr. Fadila, can you please answer the question?
Thank you, Ms. Safarina. To enhance our safety culture, we can leverage technology in several impactful ways. First one is develop or adopt mobile apps example that allow worker to report hazard, near miss, and incident in real time. Include feature for sending safety alerts, updates, and reminder directly to workers' smartphones. Okay, and second one, maybe you can create an interactive e-learning modules covering various safety topic available anytime for worker to access. Include quiz, video, and simulation to enhance engagement and retention of safety practice. Maybe third method is maybe you can use virtual reality VR technology to provide immersive safety training experience, allow worker to practice handling hazardous situation in a controlled environment, and maybe simulate emergency scenario to improve preparedness and response skill. Maybe the last one is you can use comprehensive safety management software to centralize safety data, track incident, and analyze trend, and then generate report and dashboard to visualize safety performance and identify areas for improvement. That's all I think.
Right. Thank you very much, Dr. Nofadila. Perhaps, okay. All right, there's one more. This is the last one, I think. Yeah, there's one more last question for our webinar session today from Nurul Natasha. How can we address and overcome cultural and language barriers in safety communication? Okay, Dr. Fadila.
Mm, to effectively address and overcome cultural and language barrier in safety communication, we can implement several strategy. As example, educate workers about the different cultural norms, values, and communication style within the workplace. And then maybe provide a safety material such as manuals, sign, training module in multiple language spoken by the workforce. Third one, maybe you can use visual aids, symbols and diagram to convey safety information where language may be a barrier. Mm, Last one, maybe you can provide or create an environment where workers feel safe to express their concern and ask questions about safety, such as suggestion box or regular safety meeting where worker can provide feedback.
That's it, right?
Yeah.
All right. Thank you very much, Dr. Fadila. Okay. I think, right, that's all lah for today. All right. We have come to the end of today's session. Thank you, Dr. Nofadila, for joining us today and providing such insightful information. To our wonderful audience, thank you for joining us at this webinar. We look forward to your comments and participation at future events hosted by the MAHSA University. Please fill in the survey form, which can be found at the comment section. By the end of this webinar, a cert will be awarded. In case of any further queries, you can contact us through MAHSA website or visit our social media uh, at the you can search in our social media. Okay. Have a pleasant day. Thank you.